Hi, I'm Sarah St. Hamilton, and I'm the Director of Social Support Services for the Care Center. Welcome. We're so excited you've chosen to learn more about brain health as it relates to Alzheimer's disease and related dementias. By pressing play, you've shown your dedication to improving the quality of life for yourself, family members, friends, and your community. So let's talk about stress. Probably goes without saying that we're living in a stressful world, and we all experience stress throughout our lives. But what physically is stress? To understand that, first we have to talk about stressors, which are the things that cause stress. A stressor can really be anything from exciting but overwhelming big life events like the birth of a child to small, temporary things like being late for work or having to give a presentation. When you encounter stressors, there are changes that happen in your body, and those changes are what we refer to as stress. For example, you may notice your heart rate increase, you may feel more alert, you may feel excited, or you may even feel dread. Other times, you may be so focused on your stressors that you don't notice anything happening in your body at all, but your body is still responding to the stressor. What happens in our bodies is a natural and necessary process. Our stress response system helps us react quickly and survive in the face of imminent danger. And on a day-to-day basis, it can help us to do better. For example, an upcoming deadline causes us to feel some stress, but that motivates us to complete the work so that we can remove that stressor and return our stress response system to baseline. But when our stressors aren't time-limited and instead are relatively chronic, that constant activation of our stress response system can lead to physical, emotional, and psychological strain. So what exactly does stress do to the brain? Well, let's start by talking more about brain cells themselves. Brain cells are responsible for sending and receiving messages to other parts of the body, as well as from one part of the brain to another. One easy way to think about the brain is to think of each brain cell, or neuron, as a tree. In fact, the part of the neuron that receives messages from neighboring cells is called a dendrite, which comes from the Greek word dendron, meaning tree. Neurons need to be healthy to send messages, just like trees need to be healthy to maintain their branches. Research shows that when we experience lots of stress, especially stress that lasts for a long time, our brain cells lose that wonderful, healthy branching we once had, turning our healthy tree into something more like the Charlie Brown tree. So how can we reduce our stress over time? One piece of the puzzle is to try to limit our number of stressors. This might mean critically evaluating how many responsibilities we have and asking for help when we're feeling overwhelmed. That doesn't work all the time though. Often we aren't in control of the things that stress us out, which is partly why stressors are stressful, because we can't control them. What we can control though is our behavior, the things we do to limit the damage that stressors do to our bodies. One great example is meditation. Research suggests that meditation is great for the brain. In fact, it's even great for people who already have cognitive impairment and are in the earliest stages of Alzheimer's disease. In the figure you see here, all of the participants in this study had a diagnosis of Alzheimer's disease, either at the mild impairment or early dementia stage, and none of them had meditated before the study started. The top row shows the average brains of older people with early Alzheimer's disease who meditated for 6 months. The bottom row shows the average brains of older people with early Alzheimer's disease who did not meditate during the 6 months of the study. The regions of the brain colored yellow or red are regions of the brain that improved or got thicker after the 6-month intervention. As you can see, those who meditated had lots of increases in brain volume, despite the fact that we would expect to see their brain volume decrease due to their underlying Alzheimer's disease. Other behaviors we can engage in that help to heal or reset our bodies during times of stress are engaging in physical activity. Even if you only have a spare 10 minutes, doing things like going for a walk or doing some stretching can make a huge difference on how stress impacts your body. Taking care of your emotional well-being is another great way to combat stress. Journaling, talking to a friend, working with a professional counselor or therapist, engaging in social activities. These are all things that can help you to feel connected and supported, which signals to your body that you are safe and encourages your stress response system to return to baseline rather than being on high alert. So what's our take home here? Reducing stress is incredibly important for keeping your brain healthy over time. We don't often have control over our stressors, but there are things we can do to reduce how those stressors impact our bodies. So I encourage you to plan to include activities that reduce stress into your daily routine, even if you only have 5 to 10 minutes a day. I often have to remind myself that engaging in stress reduction behaviors is most important when we feel like there is absolutely no time for it. But it doesn't have to be perfect or take up a large chunk of our time in order to positively impact our stress levels and our overall health. So the next time you're feeling overwhelmed by your stressors or are noticing signs of stress in your body, remember that even small stress reduction behaviors can have a positive impact on your health, and you're worth the effort that it takes to care for yourself.